At present, we have a projected $2.1 million deficit in the town's budget for fiscal year 2008. That projection, which was made back in October, actually is now grown to $2.5 million because the amount that we thought we were going to be required to appropriate for pension, the pension costs for FY 2008 has gone up by $400,000 based on documents we received from the state. So we're facing a $2.5 million budget deficit, and the question that we're all facing is how are we going to close that gap? We can't close it by increasing taxes because we already tax you to the max. That won't be a surprise to anybody. The local aid picture, the state's local aid, that picture is looking very bad. If you've been following what people are saying on Beacon Hill, they're looking at $1 billion budget deficit in the FY08 budget. And I heard Speaker DeMasi say something on the radio in the last day or so to the effect that cities and towns should not even expect to get as much local aid as they got last year. So we may actually see this deficit picture get worse because of local aid. The other major source of revenue that we have, in addition to taxes and state aid, is local revenues. And there, the manager traditionally has been pretty conservative with his estimates. But even if we take what the manager is projecting and add 10 or 15%, if things go well, that would mean about another $1 million to $1.5 million. So we would still be looking at a deficit of around $1 million to $1.5 million. On the expenditure side, we're looking at a $1.8 million increase in health insurance costs alone. Since FY 2000, that is the last 8 years, the cost of health insurance for the town has gone up 133%. And if you compare that with expenditures elsewhere in the town budget, our spending on public safety in that same period, those 8 years, has gone up only 32%. For public works, it's gone up 27%. For education, it's gone up 26%. For our veterans programs, it's gone up 22%. For the Council on Aging, it's gone up 18%. For the Recreation Department, 13%. That's over the last 8 years. If you look at that same 8-year period, inflation alone has been 23%. So that means that for our programs for veterans, our programs for the elderly through the Council on Aging, our recreation programs, we're not even keeping pace with inflation. All of those other programs are getting squeezed. So without some sort of cost containment on health insurance, there's no way we can achieve the other objectives that are in these budget policy guidelines. We will not only not have money for any program enhancements like the streets and sidewalks and planning and recreation and so on, we may face the need for cutbacks in current programs, which, as I said, have already been squeezed over the last 8 years. I don't know if we'll actually have to lay off staff, but at the best, what we're looking at is that town departments are going to have to try to maintain the same level of services with fewer resources. And that's what they've been doing for a long time now.